what are actionable things that anyone listening can do, whether they're, suffering, not, they don't necessarily have a mental illness, but they're suffering from anxiety, anxiety like symptoms, depressive like symptoms, or they do have a mental illness, that they can do, actionable things that they can do in order to improve their metabolic function and hopefully improve some of the symptoms that they're having.
So it's really going to depend on the person and the circumstances. So because again, it's there's not a one size fits all solution package. If you're an alcoholic drinking heavily, that's your solution. That's step number one, at least for you. If you're somebody who's not sleeping, that's solution number one to you. If you're in an abusive relationship, getting to a safe place is solution number one to that person. So I can't offer a one size fits all solution, but the comprehensive holistic package, if you're brain fogged, mildly depressed, burned out, anxious, what should you be thinking about? I want you to look at your diet. If you're overweight or obese, if you've got signs of insulin resistance, which a lot of people don't know this, but 50% of Americans have prediabetes or diabetes. 50%. So if you're a little bit overweight, it's all in the gut. In particular, if you've got a lot of gut, you probably have a lot of visceral fat, which makes it much more likely that you've got insulin resistance or prediabetes. If you've got that, that means that already you've got a metabolic problem and it's probably affecting your brain. And so if you're suffering from symptoms like burnout, depression, anxiety, whatever, there's a good chance that that's playing a role. And the easiest thing to do is clean up your diet. Think about changes. I'm not going to give a one size fits all prescription because some people want to be vegan, other people want to be vegetarian, some people like animal sourced foods, they like a lot of meat and eggs, and I can work with any of those people. Like, all of those are options. You can lower your blood sugars on any of those types of diet.
So should that be the goal regarding dieting, is lowering blood sugar?
Lowering blood sugar in order to improve insulin signaling. And the easiest concrete one size fits all solution I'm going to give is eat real whole foods. Get rid of the processed junk food. Get rid of added sugars. Don't drink calories. Drink water, coffee, tea without sugar. A lot of people are like, well, that's boring. And I'm like, well, how's life being burned out and anxious and depressed? Like, how's that working out for you? What most people don't realize is that if you make diet changes like I just outlined, the first 2 weeks really suck. No, I'm not going to sugarcoat it. They're going to suck. You're going to hate life. You're going to feel like there's no way I can live the rest of my life without my sweets. I need to treat myself. If you can actually do 3 months of that, you actually won't miss it as much or at all anymore. And more than likely, if the dietary intervention works for you, you will be a new person.
Is there a marker of insulin sensitivity, like a blood biomarker of insulin sensitivity that you know of?
I mean, there are numerous.
Okay.
So you can just do a finger prick blood glucose fasting. Should certainly be less than 100. Yeah. And again, for a lot of people with prediabetes, it's not, or diabetes, it's certainly not by definition. Some people do continuous glucose monitors. You can get a fasting insulin level from your doctor that can show insulin resistance. So there are lots of measures for it. Most of them you're probably gonna have to work with your healthcare provider to figure out what's best for you. But fasting glucose is cheap and easy, and your healthcare provider should be able to do that with you.
I love exercise as, like it builds autonomy, taking control back in terms of your symptoms and your mental illness. You describe a lot of stats in regards to the benefit of um, exercise, aerobic especially. Anything you want to mention in regards to someone doesn't exercise, they're looking at exercise to kind of take back control of their symptoms? What would you suggest?
So, huge fan of exercise, and there's zero doubt people who exercise a lot have better metabolic and mental health, and exercise as a treatment can be really powerful. It usually needs to be coupled. So exercise alone, you can't stay on your junk food diet and think you're going to outrun a junk food diet. You're not.
Yeah.
You're not going to be able to outrun or outlift a junk food diet. You're also not going to be able to outrun or outlift bad sleep. Those are the three pillars in my mind: diet, nutrition, exercise, and sleep.
Can I just interrupt you real quick, because I found it extremely interesting regarding exercise, and I think, was it insulin sensitivity? If you continue to eat junk food, for example, right, you continue to express insulin resistance despite I think you mentioned 45 minutes of aerobic exercise 3 to 5 times a week, sorry, you continue to have insulin resistance.
Yeah.
Right.
So exercise alone, like I was just saying, exercise alone is not going to outrun a bad diet and insulin resistance. And actually, here's the frustrating thing for some people, but again, knowledge is power. So don't get frustrated with this, get empowered with this.
There you go.
People who have high levels of insulin resistance, so if you are obese or already a type 2 diabetic, you have high levels of insulin resistance, those people actually early on do not get the benefits of exercise right away. And there was one study that actually showed that exercise actually kind of caused higher levels of inflammation in them afterward, whereas in healthy people, it's the opposite. So healthy people get the adrenaline high. You probably get it. I get it. We feel good after we exercise. And if we don't exercise, we feel bad. And then that motivates us to go exercise again. If you're already obese and metabolically compromised, or type 2 diabetic, or mentally ill, there's a good chance exercise alone might even make you feel a little worse early on. I say that knowledge is power. I'm going to tell you, push through that discomfort, push through that. But to that person, I'm going to more invoke the dietary changes. So clean up your diet at the same time or even before you start the exercise plan. But then to get started, I mean, it can be anything. You know this better than I do, but it can be anything. If you don't do anything, if you are 100% a couch potato, go for walks. Start with walks. If you can't walk far, walk around your house a couple of times and walk up and down the steps if you have steps in your house. Build up to get outside in nature, get some sunlight on your face any time of day, whatever. Get outside, build up to walking. Try to increase the intensity, like do that for a week, but then increase the intensity. I'm going to walk faster, or I'm going to swing my arms more, or I'm going to take longer strides. I'm going to do something that's going to increase my capacity. At the same time, you could start, resistance training, try to build some muscle. Muscle is great for, muscle has mitochondria. Those muscles actually are sending signals to your brain that impact your brain health. So bigger muscles actually are associated with better brain health.
Now you say that people that are obese and already have like really severe insulin resistance, you're telling them push past because that, for them to gain insulin sensitivity, it's just going to take a little bit longer than the average person.
Yes.
Yeah.
And that it might hurt them more in the short run.
Yeah.
So, but this is the challenge, and this is where a lot of people go wrong. The obese person comes to this really fit trainer. The fit trainer says, you are going to feel so great after a good workout. Don't worry. I'm going to help you. I'm going to show you how it's done. And then this fit trainer is going to say, there, don't you feel great? Like the next day, don't you feel great? I feel great. And the person's going to say, no, I actually feel worse.
Yeah.
And the fit trainer's going to think, you're making excuses. You're lazy. What I'm saying, knowledge is power. No, that person really does feel worse. We know that from studies. We know it from like studies published in the top biological journals like Cell. That person really does have higher levels of inflammation. That is making them feel worse. They have a right to complain. It doesn't mean they have a right to stop. But the trainer needs to stop telling them you're going to feel great. That's not true. It's not accurate. The trainer needs to tell them, you might feel like shit tomorrow. And we're going to get through it. And I'm going to be here with you. And why are we going to do it? Because a month from now, you are going to start feeling better. And you're going to be stronger and faster. And that's when you're going to get the rewards. But in the short run, it's going to be painful. When I work with an alcoholic and try to get them to stop drinking, I don't say, I'm going to send you to this detox and you're going to feel great. I don't say that.
Yeah.
I say you're going to feel probably the worst you've ever felt in your life. It's going to be horrible, painful. You're going to be shaking, probably insomnia. It's going to be awful, but they're going to get you through it. They're going to keep you safe. They're going to take care of you. They're going to make sure nothing bad happens to you, but it's going to be painful. Why am I asking you to do this? Because 2 months from now, you're going to have a new life. But you got to get through the hard part first. And I think we need to be giving those types of messages to people who are metabolically or mentally compromised, because it's not fair. If we mislead them and make them think it's all going to be great, then they think either you don't know what you're talking about or there's something wrong. Like I'm sick because I'm not feeling better. And clearly whatever you're recommending to me isn't safe. And you're assuring me that I should feel better, but I don't feel better. I actually feel worse. So either you're an idiot, you don't know what you're talking about, or I'm just a lot sicker than anybody you've ever worked with.
Yeah. Yeah. Now, so we said diet, exercise, mentioned sleep. 8 to 9 hours is the recommendation that I thought I heard in your book.
7 to 9.
7 to 9.
So, yeah, 7 is usually enough. Some adults every now and then can get by on 6.
Yeah.
Any less than 6, I'm not going to be a big fan of. But the goal is sleeping well, sleeping through the night. Here are the huge 2 goals: waking up feeling refreshed, being able to get through the day without dozing off. If you don't feel refreshed when you wake up and you're dozing off through the day, there's something wrong with your sleep.
Outside of the time?
There's something wrong with your sleep. And it could be time. It could be quality of sleep. If you're using a lot of medications, if you're drinking every night, that's going to mess up your sleep quality. But if you are overweight or obese or have type 2 diabetes or a mental illness, you're at much higher risk of having sleep apnea.
Mm-hmm.
And that's not within your control. That's not an easy thing to fix. You need to get evaluated for sleep apnea, and you might need a CPAP, at least while you're on your journey. If you can lose the weight, if you can get into better metabolic health, the sleep apnea can go away. You can put that into remission so that you don't need a CPAP machine. But in the meantime, you may need the CPAP machine to get you through, or you may need it for life. Um, but those are the two most important metrics: waking up feeling refreshed, getting through the day without dozing off.
Yeah. You mentioned medications affecting sleep. You also mentioned medications affecting metabolic function. And I think that's really important because, I mean, America is a medicated society, right? Fact of the matter. So, and even some of these psychiatric medications are causing like paradoxic metabolic dysfunction, right? Where maybe you have like a improvement in function initially, but then in the long run you have some like dysfunction that happens. Um, can you mention regarding medications causing metabolic dysfunction, and if there's anything that people out there should look out for in regards to being on a medication that might be causing metabolic dysfunction and thus some of the symptoms related to their mental illness?
Yeah. So the first thing I want to say before I dive into this at all is, if you are on a psychiatric medication, please get professional help
Yeah.
before you try
getting
to
off of it.
adjust your meds or
Yeah.
go off your meds. It is a dangerous, life-threatening nightmare for you to adjust your meds on your own. I have seen numerous patients get suicidal, depressed, manic, psychotic, all sorts of things when they take their medication matters into their own hands. With that said, this theory raises serious concern about medications that cause metabolic dysfunction. We have lots of them in the mental health field. Antipsychotics, mood stabilizers, some antidepressants, and others are known to cause metabolic dysfunction. For the most part, people think about them as just side effects, unfortunate side effects. What I'm arguing is that if you actually understand the granular science, they're not side effects, they are effects. That we are trying to stop hyperexcitability in metabolically compromised cells. And there are two ways to do that. One would be to restore the metabolic health of the cell so that people can go on and live happy, productive, good lives. The other is to give them a medicine that shuts down their mitochondrial function or suppresses it enough to suppress the hyperexcitability. And that can result in relief of symptoms, sometimes even remission of symptoms temporarily. But for the most part, long term, shutting down metabolism in a cell or suppressing metabolism or mitochondrial function in a cell is likely to lead to a chronic progressive illness that is not going to get better, but only going to get worse. And that sounds really awful and dire and pessimistic. And do we have any data to support what I just said? And in fact, we have an abundance of data to support what I just said. If you get diagnosed with schizophrenia, for the most part, you are going to have a chronic, progressive, horrible illness. If you get diagnosed with schizophrenia, you have a 20-fold increased risk of having dementia on top of your schizophrenia by the time you turn 66. You're on average, you're going to die 20 to 30 years younger than other people. So do we have evidence that that type of treatment might impair metabolism long term and might lead to other mental disorders and might lead to premature mortality? We have an abundance of evidence. But again, I am not a big fan of, some people are anti-psychiatry because they hate the effects of those medicines. I don't blame them at all for hating the effects of those medicines. Those medicines are mitochondrial toxins and they make people feel awful. But I'm not a fan of, therefore, the alternative should be just don't use psychiatric treatments at all and let people suffer and kill themselves or kill others or run amok in society. Like, let's just have a free-for-all and forget mental illness exists. We can't do that. I mean, more than 50% of the people in prisons have a mental illness. And most of them are there because of their mental illness. That's what happens when we just ignore the reality of psychiatry. More than 50% of homeless people are mentally ill. They have schizophrenia or drug abuse. I'm not a fan of just letting those people suffer and wither away in our prisons and our homeless shelters. Instead, I'm a fan of using science. If people understand the science, they can understand how and why a toxic medication might reduce symptoms in the short run. But they can also understand why a clinician needs to try to get the person off that medication at the same time while implementing other strategies that will restore health. Because simply taking the person off the medication, it's too late.
Now, let me interrupt you. Are you saying that the medication itself that's administered to people with schizophrenia or other mental illnesses that have a significant predisposition to dementia, that the medication itself is causing mitochondrial dysfunction and then subsequently leading to dementia?
Well, we know for certain it is causing mitochondrial dysfunction and leading to Parkinson's disease or Parkinsonian symptoms. It is leading to something called tardive dyskinesia. It is leading to tremors. It is leading to dystonias. We know that for certain. That's been known for a couple of decades. Why are these medicines toxins? What are they doing to cause Parkinsonian symptoms? They're poisoning the mitochondria.
So there's one side of things where you're saying, hey, schizophrenia, mental illness, there's mitochondrial dysfunction. Mitochondrial dysfunction predisposes to dementia, right? But at the same time, it's the medication that you administer is restore mitochondrial function initially, but then causing mitochondrial dysfunction later that then leads to dementia.
It doesn't restore. So antipsychotics don't restore mitochondrial function initially.
Okay.
Antipsychotics impair mitochondrial function out of the gate.
Right. But what I'm saying is there's mitochondrial dysfunction that the person has due to their illness, right? And what you're saying is that's not the mitochondrial dysfunction that's leading to dementia. It's the mitochondrial dysfunction that is caused by the medication that's administered to that person.
No, I'm not. So
I just wonder what would happen if no medication was administered.
So what would happen if no medication is administered?
Would they predispose to dementia?
They would still probably die early deaths and have much higher rates of obesity, diabetes, cardiovascular disease, and dementia. So in the 1800s, it was all before the antipsychotics were even invented. In the 1800s, researchers knew insanity and diabetes run in the same families. Insanity is schizophrenia and bipolar disorder. That's what that is. And so it wasn't the pills, but I do believe the pills are pouring gasoline on a fire. That these people are already metabolically compromised. And in order to reduce their symptoms, we are shutting them down even more. Let me give you a clear example. So some people might interpret based on what I just said that I'm 100% opposed to ever using antipsychotics. And let me be clear, I'm not 100% opposed to using antipsychotics. The clearest example I can give is another field called oncology or cancer treatment. In the oncology field, we use metabolically toxic substances and therapies like radiation therapy to kill cancer cells. Those substances and treatments are also taking a toll on the rest of the person's mitochondria and cells. It is reducing their overall health. People feel awful on these medications. But these medications save lives. The alternative is to let them die of cancer. I'm not a fan of just letting people die. if somebody is running amok and dangerous and agitated and assaultive because of their psychotic episode, they need to be made safe any way possible. Chaining them to a wall is not humane. I personally think it's more humane to give them an antipsychotic to make them safe. With that said, just like chemotherapy is used for a phase of the illness, we don't keep people on chemo for life. Because if we keep them on chemo and radiation for life, guess what will happen? They'll develop more cancers. The treatment becomes the cause. And what I'm saying is it's the same deal in psychiatry. The treatment can become the cause. And we need to own, the oncology field gets it. They know that. They don't shy away from saving lives, but they also don't put people on chemo and radiation for life.
That's a very interesting comparison. Yeah.
I think we in the mental health field need to step up to what they're doing in oncology, that we need to acknowledge we are administering toxic medications. We can understand how and why these are reducing symptoms and making a dangerous situation safe. But we also need to be very mindful. As soon as possible, we need to implement other metabolic treatment strategies and try to get them off of this mitochondrial toxin. That's the approach I'm hoping to work for.
Amazing. All right. So we've got actionable things to do. Diet, Mediterranean or keto, or just cut everything, cut all the junk food out.
Yes.
At the same time, exercising. Any amount is good. I'll say 3 to 5, 45 minutes aerobic exercise, and also build some muscle. Build some muscle means building mitochondria.
Yep.
Sleep 7 to 9 hours, and making sure that it's quality by waking up refreshed and not dozing off during the day. And then finally, get off medications if you can, and do it safely, and do it with the guidance of an experienced healthcare provider like Dr. Palmer or myself.
Yes.
I'd like to think so after this 3-hour podcast.